Welcome to our webinar about the current challenges in mandatory payroll-based journal reporting. My name is Carrie Hernandez and I'm the Director of Marketing at Attendance on Demand. I will be the facilitator for today's session, PBJ Misconceptions, Pitfalls, and Best Practices. I'd like to introduce our expert today, Beth Behrman. She is the Director of Communications for Attendance on Demand and is an expert in time and labor management. She's been in the industry for more than 15 years. With a background in technical training and product management, Beth is a frequent speaker about compliance issues related to workforce management. Recently, she has addressed national conferences for the American Payroll Association, American College of Healthcare Administrators, and others about employer compliance issues, including labor and healthcare reporting. Welcome, Beth.
Thanks, Carrie. Glad to be here.
So I want to get right into it. Can you tell us the purposes of PBJ and how the reporting has gone so far? Understanding most of our audience has heard this, but let's set the stage.
Sure. Well, PBJ started with the Affordable Care Act. And before anybody panics, because we all think the Affordable Care Act is going away, you should know that all of the proposals for replacement, the AHCA, American Healthcare Act, and anything the Senate is talking about does not affect this particular provision, Section 6106. So as far as we know, PBJ is here to stay. The purpose was one of the lesser known aspects of the Affordable Care Act that had to do with improving patient outcomes. So when you say what the purpose of PBJ is, it's to shed a light on the direct labor that's being provided at skilled nursing facilities for their residents. So collecting all of the data for every single day of the year and making that available publicly so that consumers can go to the Nursing Home Compare website from CMS and see on a daily basis how many hours of direct care are being given for and per resident at these facilities. This is something that's available today, but the sample is much smaller. It's a 2-week sample that these facilities provide during the survey period on their CMS 671 and 672 reports. CMS now, through the regulation of the Affordable Care Act, has said 2 weeks is not enough. We need to know every single day of the year for 35 required and 5 optional jobs, how many hours are being spent per patient for care. And the goal really is for that public scrutiny to raise the level of care, increase the number of hours, and make things like the longevity, the tenure, the turnover of the staff available as well. The idea there being that if residents are seeing the same caregivers are giving care to these patients on a daily basis, or these residents on a daily basis, then the quality of overall care is going to rise and the benefit to the residents is going to increase. Also helps consumers choose the best place for their loved ones to be when it's come time to choose a skilled nursing facility. So that's ultimately the purpose behind it.
How has it gone so far? This is the second year of mandated reporting. I'm assuming we learned a few things.
Right. We've had 3 submissions, 3/4 of mandatory submissions so far. What we've seen in the feedback we've gotten from CMS is that each quarter has gotten a little bit easier, or maybe I should say more successful in terms of the successful submissions. The first quarter, November of 2016, we saw that CMS was not ready for the volume. They were not able to receive all of the submissions they were getting. We had a delay so that people had an extra few weeks to get their information uploaded into the system.
I remember it was announced, right?
Yeah.
Even though it was very close to the deadline or right after. They said you didn't have to have it done.
Pretty much at the deadline. Okay. Everyone got an extra couple of weeks. And that was because of CMS is having bandwidth problems in their system. So we got past that.
We haven't had that problem since?
We haven't had that problem since. I think employers are updating more frequently. We're getting into a little bit of a groove. Then we had some problems with the actual errors in submissions. there is a little bit of a confusion or a challenge for facilities, particularly organizations that operate multiple facilities and have employees that work at the multiple facilities.
Oh, that's right.
We
You
were
have
getting,
to report by facility, don't you?
You have to report by facility. And we were getting errors in the start date and termination dates because those were to be reported not when the parent company or the headquarters hired an individual, but when they started working and stopped working at each individual facility. So we were getting multiple start and termination dates within the same quarter that the system didn't like.
Mm-hmm.
And we were having a lot of rejection. So that was the story in the second submission. By the third time around, which just happened a couple of weeks ago, CMS had made the hire and termination dates optional, so employers no longer had to report that. I expect what we will see and what our facilities have to really watch for is that we may see a change in file format, because turnover and longevity of employment is something important that CMS wants to measure. They can't measure that without hire and termination dates being provided by the facilities. So this is a temporary workaround just so that the facilities can have successful uploads and get the information into the system. Right now those are optional. We will potentially have a new file format or perhaps just a single hire and termination date for a parent company as opposed to the participation at individual facilities for these employees. So look at that for an area that's going to change, and these are both for true employees of these organizations but also for contract workers, which has been a challenge all along for employers, agency and contract staff, and really tracking their hire and termination dates, in other words, their start and stop dates at individual facilities, as well as the specific jobs and the specific number of hours that they're working, when in fact these folks aren't actual employees of the individual facilities.
Yeah, so I can see as a facility manager, we want that continuum of care, and we want employees that know our facility and how we do things. But this challenge in terms of tracking it to meet CMS needs and what they're trying to report on the same way can cause multiple iterations of file formats, which, depending on how you set up your reporting and how you've funded and staffed that as a one-time thing, we're really starting to look at the fact that this is something that can become complex, and you have to have a system that allows you to adapt to these changes. Obviously, continuum of care is interesting on both sides and something we all want, but how it gets tracked and reported for our business purposes versus how the government measures us, that could be different.
There's another big difference between the way the government looks at time tracking and the way the facilities do is in what CMS considers a day. So ultimately, they're looking at reporting in the Nursing Home Compare website the number of hours per patient day in the different job categories. But the day there is the key word. And facilities have, for the most part, have found solutions around this already, but just as a reminder, CMS said that the day had to be a calendar day. They're 24-hour organizations. The night shift starts work at between 10 and 11 p.m. They work past midnight to 6 or 7 a.m. the next day, and for PBJ reporting, that shift had to be separated, divided out at midnight, and reporting those hours separately, completely differently than they do for time card reporting to employees, for their own labor reporting, made it very difficult for reconciliation, looking at their PBJ reports versus their other labor reports. So something that was very important for timekeeping systems. Most employers have found that there's a huge time savings in having their timekeeping system generate their PBJ file, that they simply upload the file. For those who were manually entering, they had to come up with a way to do the math. They couldn't just rely on their time card reports. They had to figure out a way to do the math to separate those hours from the calendar day, or from their shift, their third shift, into the calendar day. So that was a challenge for people doing things manually. Continues to be a big challenge because many employers at this point are uploading for their own employees, but still manually entering hours for their agency and contract staff. So there may still be some of that going on there for employers. So one of the things that we often recommend is they look at putting those employers into their timekeeping system, and just don't send those hours to payroll. Just use them for your PBJ reporting.
Okay.
So even for organizations who've been using a timekeeping system or are now using a timekeeping system, they had to go through a certain amount of configuration because you had to code in the system direct care according to CMS and which hours weren't. This was a challenge because it was even different than the hours that they were used to reporting for the CMS 671 and 672 report. So for example, on 671, you could count training hours as direct care, whereas in PBJ you can't. In the timekeeping system, a way to track different hours so that we're talking about direct care hours and not including things like training time, or things like paid lunches, or things like vacation days, sick days, holidays that the employees aren't actually working. There are contract staff, like many organizations contract their medical directors. Many organizations contract in their physical therapist or occupational therapist when the dentists come in, those types of
Highly professional
caregivers who aren't necessarily on staff full time, particularly in smaller organizations. Those folks have never typically tracked time, don't want to punch a time clock. So organizations have the option of entering that time in manually, but the important thing is that however they determine the number of hours, it has to be an auditable process.
Okay.
So the recommendation for these facilities, for those types of direct care, is to tie it back to invoicing, tie it back to the contract that you have with these professionals to tie it to the number of hours. So to be able to have a way to justify the hours of care if they aren't hours that are specifically tracked in a timekeeping system, whether it's your timekeeping system, your agency's timekeeping system, or as an alternative, a specific contract that you have with a professional that outlines the type of services, the number of hours of service per month or per week, that you can then apply a formula to get a daily average that you can enter into your PBJ system.
Okay, so you have to have a lot in place, and some of what we talked about before in terms of there's a bit of a ongoing process to getting PBJ reporting right, and for
Yes.
what looks like the foreseeable future. This is not
Yeah.
a one and done thing, or I've got it now.
Right, so timekeeping systems can be an essential part of that, particularly for the employees that you're already tracking in your timekeeping system. The point is, if you choose to have some direct care employees who are not using a timekeeping system, that there has to be an auditable process. If CMS were to come in and audit, you have to be able to justify the number of hours that you've entered. The timekeeping system, and it has its own audit trail, its own documentation. It's very easy to run reports from a timekeeping system to justify and explain the entry that you've made in PBJ. For those folks who aren't in your timekeeping system, make sure that you've documented your process. You can show CMS a process documentation, and then you go back to specific invoices, specific timesheets or reports that you're getting from your agency or from your professional, self-employed professional to justify the hours that you submit, because ultimately each facility is responsible for those hours.
So what are some other challenges where you might underreport, where you miss that opportunity to share your great work?
Right. Well, this actually, the whole opportunity that PBJ brings to the table in dealing with the timekeeping system that maybe you haven't really looked at for a number of years, is to sit down and really audit all your timekeeping rules. Now is a very good time to do that. We've gotten through the first 3 reporting quarters. I think employers are kind of like taking a breath, exhaling a little bit, and starting to look back and say, well, now how can we do this better? How can we do it more efficiently, spend less time doing it? But importantly, how can we make sure we're making it as accurate as possible? And there's a few settings in the timekeeping system that can come into play and can affect on a daily basis for each individual employee, not a lot, but over time, over the course of a full quarter, a full year, by the time you add all of your employees together, can make a difference.
Okay.
So one of the first things to talk about is rounding. Rounding, as most folks are aware of, will take an odd punch time and round it to an interval that's easier to add.
Right, which made a lot of sense when you did your own adding.
Exactly. This came about from the days when folks punched a manual time clock and supervisors had to come in and add up their shift hours, and it was much easier to add by quarter than to do minute math.
And so, of course, we just put that in the software, even though
So,
the software doesn't
right,
care if it's by the
what-
second.
That's what everybody was used to, so it carried forward to the automated days of reporting.
Now here's a challenge. It's causing me a problem.
Well, it can cause time, that those little 5-minute, 7-minute increments, to be rounded back. So you're actually losing a little bit of time. Now, by the same token, you may have time rounding forward.
Right.
So how much difference is that really going to make? Perhaps not a lot, but it's a good opportunity just to take a look at your overall timekeeping practices. Rounding isn't necessary anymore. Our systems can calculate to the minute. So it's something to think about. Another thing to look at is automated lunch deductions. Not something that I personally advise in today's day and age, but many folks do because their employees take a lunch and it's just not convenient, or they forget often to punch out. And it's fine. It's allowed as long as organizations have a well-publicized, well-used method for employees to challenge or to notify their supervisors, hey, I worked through my lunch today, and they get that time credited back.
Yeah, but I can imagine in healthcare, it's even more challenging. You really have a harder time planning your lunch, in my opinion, than in the job I do.
People are very busy. It's really easy to forget to punch. It's easy to just automatically deduct that and trust that your employees are going to take the time. And in many cases they do, and that's fine. Something to think about, though, is when they don't. And they do work through fairly frequently. They get called to assist a resident. They end up using some of their lunchtime. When they work through, the typical timekeeping system thing to do is to credit that time. You want to make sure that that credit is part of the time that counts toward PBJ.
Right.
So that's something that employers often overlook, is making sure that that credited time gets included in the PBJ reporting.
And that can be a lot more than 3 minutes, like rounding.
That's right.
But
That
when you add it all together, I bet they're more.
That can really add up. Another thing to look at is a lot of healthcare, not perhaps as often in skilled nursing as in hospitals, but we do see it occasionally, is that facilities will have paid on-call or paid callback. Okay. So that's when you have a caregiver who is not going to come in, but will, if it's a busy night, something's going on, you have somebody you can call to come in and help. If they're getting on-call pay, so they're getting a certain base hourly rate just for being available and remaining within 30 minutes distance from the facility or whatever rule might be, that time can't be tracked. So it's paid time, but it's not direct care.
Right.
When they come in, though, it is. So just looking at how that is configured is important. Similarly, some organizations have what's called callback pay. So if there's an absence on the second shift, for example, and a first shift person has gone home and gets called back to work, they're guaranteed a minimum number of hours. So they might only work 1 hour until a different employee can come and relieve them, but they'll be paid for 3 or 4 because that's the agreement that's been negotiated, and that's a little incentive for somebody to come back into work because they know they're getting a minimum number of hours even if they only work a short period of time.
Right, but it could get you in real trouble with calling it care.
Could get you into trouble if that's coded the same way all the hours, the direct care hours, are coded. So you have to make sure that the callback pay is not included in PBJ, but the time that they're actually working for direct care is.
We certainly recommend finding out what those differences are prior to reporting. And it sounds like you expect auditing to come along at some point. We're not going to know when yet, right? Enforcement is on the table, but we
Right.
do expect it to come
We
along.
expect it will come. What we know right now is that CMS is planning to convert the Nursing Home Compare website from the 671 reporting to PBJ reporting in early 2018. So
Oh, that's
next
quick.
year this is going to happen. What we're already seeing, if you look at the slide, what we're already seeing is an indicator. We have a little green dot next to the facility name on the Nursing Home Compare website that shows that these facilities have submitted their PBJ files in a timely fashion. So they're submitting them successfully, submitting them on time. If the dot is gray, it means that these folks either didn't submit at all or they missed the deadline. So it was very quick, very, very quick. I was quite impressed, pretty fast for government work, that they had these indicators in place as quickly as they did. What we expect is after it's been converted, it's being reported to the public, now enforcement is going to be stricter. Now CMS will begin to look at how are they going to audit facilities. They will investigate who isn't reporting on time. There's going to be a tremendous incentive to report on time, because if you report late, CMS will accept your file, but they won't calculate that data in your quality rating. So you will miss an entire quarter
So it'll look
on
even
the
worse.
system, and your numbers are going to be looking pretty bad. The regulation does give CMS the ability to penalize monetary penalties for noncompliance. We are keeping an eye to see
Right. But it
what the
sounds
audit
like-
process and penalty process is going to look like.
So given that, the facilities are continuing to invest to stay compliant. Do we have any idea how much that costs these days?
Well, we have some cost figures that were sourced from CMS, and they've been reported by some healthcare consulting groups. They have said that the setup for an automated system, so setting this up within your timekeeping system, costs between $500 and $1,500. So that's the cost that's already sunk by most of the facilities out there to get their timekeeping system to appropriately generate the PBJ file, everything coded correctly. There will be additional costs involved if CMS changes their file format again.
It sounds like we can plan on that.
I think it's likely to happen. They have actually changed the format itself only once, and that was in between the optional reporting period and the mandatory reporting period. Since the reporting period was mandatory, what has changed is that a couple of the fields in the file are now optional and not required, but the format of the file itself has not changed.
Okay.
Now, in some cases, just changing that format to be, or that date, the higher determination date, if you recall, is what's become optional. For some time and attendance vendors, making that optional is a configuration change that costs money. For others, it isn't. So it will depend on the particular provider as far as that goes. But we can expect, if there is another file format change, and I think it's only reasonable to expect that we will see that. CMS continues to address the sticky points that employers have, the time-consuming nature of all of this. As they attempt to streamline things, we can expect to see some further changes. And you're looking at that same kind of cost investment every time a major change comes, because every time that comes, you have to reconfigure the system to do that.
That's $500 to $1,500?
$500 to $1,500.
Okay.
However, that compares very favorably to the cost of manual entry, which CMS estimates the initial year at between $4,100 and $6,800 a year. And you can imagine, because you're doing this reporting and typing in a daily figure for each job, for each employee, the bigger facility you are, the more of an investment you have to make in that data entry. They estimate that as facilities get used to this, they'll get faster. So as facilities become proficient, CMS is estimating between 2,700 and 4,200 hours per year and 4 hours of staff time per week
Oh, that is
to enter
extremely
that.
sizable.
So I think there's a substantial ROI in automating. Again, what I have seen in most facilities that I've spoken to is that there's a little bit of both. Most employees will be in a file and uploaded, but a few will be entered manually, those professionals that we talked about earlier. So you can expect a little bit of time for manual entry, but certainly minimizing that time is well worth the investment of the configuration or the payment you might have to make for a configuration change.
Right, and it'll protect you from an enforcement standpoint and auditing eventually as well. And it's going to be hard to estimate the cost of a bad
Right.
audit at this stage in life, but we all know generally what that phrase means.
Right. And thinking about that, I think as facilities have already kind of got their ducks in a row in terms of generating this file. We talked about some other best practices of auditing timekeeping practices and making sure that you're accurately capturing every allowable minute of time for the PBJ file. It's also a good practice to then document what are your timekeeping practices and how do they affect PBJ? What are your practices for determining hours that aren't in your file upload to CMS that you're manually entering, just to minimize the cost of those audits down the road? If that's already documented, you have that piece of the audit already, and then it's just looking up the records to justify that information for the specific period of the audit that will be coming down the road from CMS.
So if I'm going to change HCM vendors, what do I need to be thinking about? How do I even get started on that path?
Well, there's a few things. So we already talked a little bit about the auditing your timekeeping rules, taking a look at what you might be able to automate better, and having your list. So you may already have a basic list of features that you're looking for. Of course, the first one is to make sure that your file is indeed tracking hours on a 24-hour calendar day and not just pulling in your shift totals, because some files did that for the early reporting periods. Want to make sure that the most basic requirements being met. Another challenge that folks will have as they start to think about moving from one system to another is that CMS expects that an individual will always have the same employee ID. So one of your requirements in moving from one system to another should be that you can bring that employee ID with you and assign it to the employee in your new system. If you can't, then that longevity is lost. Now, right now, with hire and termination dates being optional, it's not such a big deal. So if you're thinking about changing, you might want to change before that becomes required again with the next iteration in the file or the next iteration of changes that we might see from CMS. Once the hire and termination dates become required, then it's going to become essential that you can carry your employee ID number from one system into another. Remembering that that's not the Social Security number, that's a unique ID that gets used for PBJ. You want to make sure that if you change systems, you can bring that employee ID with you. Another thing to think about is the timing. If you are uploading a file to CMS, you're uploading an entire quarter at a time. That's the way the file is designed for CMS. You can replace the entire quarter, or you can just add what's new or different in each file that comes up, but it's containing a full quarter's data. So coordinating that turnover from the contents of one file to another is something that you're going to want to look at very carefully and be sure that you are able to do a merge rather than a replace on the file. Be careful about it's a setting inside of the upload file, how you bring the files into the system. May be different on the first quarter that you're importing from a new system than what you might want to do going forward after. So key to talk to your new vendor about how your uploads are going to work if you have part of your quarter coming from one system and part of your quarter of data coming from a new system. So I would say beyond the basics of the appropriate tracking to look carefully at employee IDs and work carefully with your vendors about that transition period when you have a quarter being represented through two different timekeeping systems.
Yeah, I see. You could be making an investment for improvements and end up having to slide quite a bit backwards
Right.
at the same time, and
Right.
it's not going to accomplish your goals.
Right, and be prepared that you as a facility are going to have to make that same investment in designing the mapping and communicating your jobs and working with your employees and the time clocks and the transfer and all of that setup you're going to have to do with the new vendor that you just already did with your previous one. But if you get a new vendor that's going to be able to do more for you, handle your employees and handle all of your rules, your investment will be well worth it.
Yeah, this is a good time to just take a look. Whatever you decide doing, you just want to highlight the kinds of challenges you could be facing or misconceptions you might have, and point out that this is a great time to experiment and get it right,
Mhm.
starting with that all-important green dot on
Yes.
the website. I really appreciate your time here today, Beth. Hopefully our audience got a lot out of our discussion, and they can move their business forward. So thank you.
Thanks very much. Happy to join you today.
Have a great day, everybody.